Okay, so what we're doing today is we're going to tape Adam's shoulder for instability. So the amount of tightness, I guess, we want from this tape can be determined by how much initial internal rotation we put Adam in our starting position. So if I want to really tighten him up, I'll have him in full internal rotation to start with. If I don't want him too tight, I might just have him in sort of half internal rotation to start with, bearing in mind that that's the motion we're trying to protect. So we'll put Adam into sort of 3/4 internal rotation, which is sort of hand just into the waist. The biggest challenge with instability taping, bearing in mind that proprioception is our main focus, is getting the tape to stick. And I think in football players and rugby players, because of the amount of movement and the amount of sweat, we often find that the tape doesn't stick. So sometimes you can tape all the way around chests and things like that. I won't do that just at this minute, but I'll go through the basics and then I'll show you where the variations come in. So I always use the Fix-A-Mole underneath because I think it's the best sticking. You can use some spray adhesive underneath or some deodorant or something if you want, but usually I'll put an anchor at the arm, not going all the way around to constrict muscle I guess swelling as they expand the muscle and contract. And then I'll also put one at the top as another anchor. So you can use more strips running down the sides, so one there, one there, one there, even one at the back to cover more if you want. I'm not going to do it for the demonstration purposes, but you can do that if you're finding that the tape is not sticking to the player. So the first thing I do is my rigid anchor down the bottom, covering the going over the top of the Fix-A-Mole, and then my rigid anchor at the top. Now this is probably the most important part of this taping. It's what really stops the external rotation. So what I do is I start at the front like that, lay the tape down, I come across the back of the shoulder, and then I'll lay it down across the front. Now, you can come down as far as there or wherever you want, depending on how much you need to get it to stick or how much the tape comes off in a certain athlete, but this is the minimum, and so I just come across to the base of the clavicle. I'll usually do 2 of those, one just anterior to the other. And just lay it down like that. Now you'll see from an anatomical sense that is what's stopping external rotation. Can you feel that tight?
Yeah.
Nod, say yes. So 2 of those usually will do the job. The rest of it is just a little bit of reinforcement of the anterior capsule, but I don't think it does a lot. And players, I think, like it from a comfort sense. So I'll generally do a fan running from the middle of the joint, one in front of the other, anteriorly, just fanning across. So I start with my most posterior one, then I'll do one anterior to that, another one anterior to that, and I might do a 4th anterior to that. So that's kind of what it looks like. Then I'll lock it in there and there. And if you have come down further, down to here, you can actually do some elastic taping around the chest to actually lock it down so that you lock both ends down through here. Bearing in mind you wouldn't use rigid around the chest because the chest has to expand, so you'd only use elastic for that. One thing which players are using these days, I don't have the tape to demonstrate today, but there is the elastic stretchy tape which players are using over the top of this to keep, I think it adds a little bit more compression to the joint as well, so you get that proprioceptive feedback coming from within the joint, not just externally from the skin. So that compression effect from the stretchy tape can be quite good. Now what I do with that is that basically I start from posterior and I run anterior, then I go around the arm, and then from posterior finish anterior. So I might do 2 lots of that, and then I'll stick that down with Fix-A-Mole to finish. So that's with the elastic stretchy tape. But essentially, that's the basics. You might put the elastic on top of that, and then anchor it down with the Fix-A-Mole over the top there. That's it.